Selamat sejahtera and good morning, madam. My name is Ugendran, anak lelaki Ravichandran. My matric number is H21B2095. Today, I would like to present my individual assignment. The title is the respiratory system. The respiratory system is the primary function of the respiratory system is to supply the blood with oxygen in order for the blood delivery oxygen to all of the body. The respiratory system does this through breathing. When we breathe, we inhale oxygen and exhale
In
carbon
the
dioxide.
respiratory system, we have the upper respiratory system and lower respiratory system. The upper respiratory system is nasal cavity, pharynx, larynx, and lungs. And the lower respiratory system is trachea, bronchi, bronchioles, alveoli, and diaphragm. The nasal cavity is provided moisture and warms the air and as a place of odor receptors that are olfactory. The disease of nasal cavity is nasal cancer. It is a cancer that starts at the base of the nose. The reason because excessive alcohol intake. And the second is pharynx. Function of a pharynx is relieve pressure in the ear and drains fluid from the ear and sending food and fuel to the digestive system, also pushing food in the esophagus so that is not inhaled. The disease of pharynx is a tonsillitis, can be caused by a virus such as the common cold or by bacterial infection such as strep throat. The third respiratory system is larynx. Larynx serves as a speech device along with the soft plate. The disease of the larynx is neoplastic. The neoplastic usually grows slowly and cannot spread to other tissues. The fourth is trachea, the connector of the nose and lungs, which is the transport of air in and out of the lungs. The disease is tracheostomiasis. Is the most commonly caused by inflammation and scarring that follow intubation. Insertion of a breathing tube into the trachea during a surgery, or when there is the need for mechanical ventilation respirator. Number 5. The last of respiratory upper system, the lungs. The function of lungs is allow us to speak and smell and channel oxygen to the cell in the human body, remove wet gases including carbon dioxide from the body, and also protect our respiratory tract from harmful substances. The disease of lungs is asthma. Asthma is a long-term condition affecting children and adults in this year. The air passages is the lungs become narrow due to inflammation and thickening of the muscle around the small airways. The causes asthma symptom is shortness of breath. One of the lower system, the respiratory system, is bronchi. Bronchi is heating and cleaning the respiratory tract and is the main function. The disease of bronchi is the bronchitis. It is an infection of the main airways of the lungs, bronchi, causing them to become irritated and inflamed. The main system is a cold, which may bring up a yellow, grey mucus and phlegm. Bronchitis may also cause a sore throat and wheezing. The number 7 is a bronchilus. The bronchilus is the consist of smooth muscles, elastic tissues and epithelium, and its function is a gas exchange is the main of function of bronchilus. The disease of bronchilus is a bronchitis is often brought on by damage from another condition that affected the lungs. Even an airway blockage like a ground or a non-cancerous tumor can lead to bronchitis. Though it is most often linked to cystic fibrosis, many other conditions can trigger bronchitis, such as autoimmune disease. The number 9, the alveoli. The respiratory system works to convert oxygen and carbon dioxide molecules from the bloodstream. The disease of alveoli is emphysema. Emphysema is one of the most preventable respiratory illness because it is strongly linked to smoking. They also can damage the lungs. The lastly is a organ. The lastly is a diaphragm system. The diaphragm system is an organ in the muscles and skeleton of the back that will spread the organs in the stomach with thoracic tissues. The function of the diaphragm is to prevent the flow of the gastric acid fluid into the esophagus by the passing from the abdominal cavity on performing respiration. They regulate breathing by assisting and revealing vomiting with activity that required an increase in the pressure of the abdominal cavity. Baik, tadi